कोविड कारण हालात इन्ने खराब ने कि हर एक व्यक्ति ਨੂੰ ਇਸ ਮਹਾਮਾਰੀ ਨਾਲ ਪ੍ਰਭਾਵਿਤ ਹੋਣਾ ਪਿਆ ਹੈ। ਉਧਰ ਅਲਬਰਟਾ ਦੇ ਪ੍ਰੀਮੀਅਰ ਜੇਸਨ ਕੈਨੀ ਨੇ ਇੱਕ ਬਿਆਨ ਵਿੱਚ ਕਿਹਾ ਹੈ ਕਿ ਹੁਣ ਸਾਨੂੰ ਇਸ ਬਿਮਾਰੀ ਦੇ ਨਾਲ ਜਿਉਣਾ ਸਿੱਖ ਲੈਣਾ ਚਾਹੀਦਾ ਹੈ ਕਿਉਂਕਿ ਇਸ ਦੇ ਖਾਤਮੇ ਸੰਬੰਧੀ ਕੁਝ ਵੀ ਸਪਸ਼ਟ ਕਹਿਣਾ ਮੁਸ਼ਕਿਲ ਹੈ। ਨਾਲੇ ਉਹਨਾਂ ਸਭ ਨੂੰ ਪੂਰੀ ਤਰ੍ਹਾਂ ਵੈਕਸੀਨੇਟ ਹੋਣ ਲਈ ਵੀ ਅਪੀਲ ਕੀਤੀ ਹੈ।
Yeah, well, it is a serious situation, but I believe we have passed the peak of transmission. Our positivity rate seems to be coming down sharply, and our wastewater data shows declines in COVID in 15 of 19 communities where we track it. And as you know, Omicron around the world has typically been a 4-week wave. So I think we're starting to come down, but we'll be going up in hospitalizations with the lag effect that we all know about for the next probably week or two. And thankfully, because of the lower severity of this variant, it's putting relatively less pressure on the intensive care, which has really been our sensitivity in Alberta. So, you know, there's going to be some difficult days ahead still for our healthcare workforce, but it is, I think, something I think we're going to be able to manage to get through this. Well, no, by the way, Evan, we took advice from our medical experts on public health experts on the approach of moving to endemic management in the summer. It turns out with Delta and its severity that we were under-vaccinated. And the key factor here, Evan, is vaccination. We have gone from about 75% to 90% first dose coverage amongst adults. We've caught up. We were 10 points behind, but we've now caught up with the national average on vaccinations. And quite frankly, we are seeing, together with Saskatchewan, the two least restricted provinces in the country. So far on Omicron, we are seeing significantly less pressure on the hospitals than Ontario and Quebec that have had far more stringent restrictions. We've done everything we can. I think we were the first province that came out with a vaccine lottery. We have spent millions of dollars promoting the safety and efficacy of vaccines. We have a proof of vaccination program for people participating in discretionary high-risk activities, etc. At the end of the day, though, it's people's choice. And I think what we're seeing in Canada, not just Alberta, on the booster shots, frankly, you know, with a lower uptake than I expected, is just, Evan, I just think a lot of people, in a way, are checking out. Like, they're just not organizing their lives around COVID anymore. And I will continue to urge people to get that booster shot. It can really be helpful in keeping them from severe symptoms and hospitalization. But at the end of the day, it's a free society, and I think what policymakers, what we've all got to come to terms with is how do we move out of Omicron and gradually, carefully learn to live with this thing, because this disease will be with us in different variants for some time.